Hi, I'm Jill Stokold. I'm here today at the Baton Rouge Clinic, and I'm excited to be joined by Dr. Katie Hammond.
Hey.
How are you?
I'm good. How are you doing?
Great. So you are one of the internal medicine doctors.
I am. Yes, ma'am.
All right. So today I kind of really want to talk to you about diabetes.
Yeah.
So, you hear a lot about it, but, you see people, you're the first line of defense, I guess, if you will. So when should a patient make you aware, or like what are some of the signs and symptoms that could be a marker of diabetes?
Yeah, so a lot of times with diabetes, what we'll see is your sugar's high. So you may be urinating more, you may be drinking more water, things like that. Now, when it comes to screening for diabetes, we screen a lot of our patients for diabetes. So for our patients, if you're over the age of 35, you are probably getting screened for diabetes.
As you age, do you increase your risk of getting diabetes?
Yeah, it can as you just kind of accumulate risk factors. And even in some of our younger patients who have risk factors, so if they're overweight, if they have a relative who has diabetes, if they have high blood pressure, we'll start screening them early as well.
And screening constitutes?
Yeah, so screening for diabetes, it's going to be blood work.
Okay.
So there are a couple ways that we can screen and kind of diagnose diabetes. So the one that we're probably most familiar with is going to be the hemoglobin A1C. And that number, it gives us a really good idea of how your sugar's been running over the last 3 months. So for the diagnosis of diabetes, if that A1C number is over 6.5, then that kind of buys you the diagnosis. And then for the A1C number, if it's between 5.7 to 6.4, then you're going to be in that more like pre-diabetes category.
So once you've been diagnosed, and that's type 2 diabetes?
Okay. Yes, ma'am.
So once you've, gone over the 6.5 marker, are there ways to come back down and no longer be diabetic?
Yes.
Okay.
So the first step in some of the medicines that we commonly reach for, one is going to be metformin. But a huge part of the management of diabetes, regardless of where your A1C is, if you're diabetic or pre-diabetic, is going to be lifestyle interventions. So that's going to be like the diet, the exercise, just doing those things, working on weight loss if we need to lose weight. So that's a huge piece of the puzzle when it comes to diabetes.
I was going to ask about prevention. So that's really it. So, watching your sugar intake, maybe exercising more. Are there other things that a patient could do?
Those are, I think just that general healthy lifestyle. So the diet, like avoiding the processed foods, the simple sugars, things like that. Exercising regularly, regardless of whether you have diabetes or not, you should be exercising regularly. It's just good for you. And then weight loss, if we need to lose weight. So losing weight can actually help kind of decrease our risk and help manage diabetes too.
So how often do you see, because I know people don't take care of themselves.
Yes.
So how often do you see where people, didn't come in when they saw maybe they, like you said, were more thirsty than normal or urinating more often, like where it's like, oh, if only they had come in just a few, months earlier.
Yeah, I'd say most of the patients who we diagnose with diabetes are completely asymptomatic. So when you're urinating a lot and you're drinking a lot, that normally implies your sugar is pretty high. So most of our patients are completely asymptomatic when they get diagnosed. And kind of depending on where they are with their A1C, will kind of tell us what we need to do in terms of therapies and starting medicines. Some people we can manage with the lifestyle, so like the diet, the exercise, things like that. And then other people we have to start reaching for medicines, and whether that's metformin or insulin or some of the newer medicines that we have, we can do that.
Right. So you mentioned hereditary or things, or so how, like what should you be aware of as far as family history goes?
Yeah, so I think in your family history, if there's a strong family history of diabetes, I certainly think that can play a role in you and your development of diabetes. Other things for our women, if you had gestational diabetes when you were pregnant, that can actually increase your risk for developing diabetes later on. So something to kind of keep in mind and look out for.
Right. Well, is there anything else you want our viewers to know about, preventing getting to the diagnosis and things to be aware of?
Yeah, I think it just comes back to that healthy lifestyle, so the healthy diet, which I know is hard here in Louisiana. But focusing on the diet, trying to exercise, regularly, and you don't have to do a lot of exercise to get a benefit for your health. And then if we need to lose weight, focusing on that and losing weight as well. So just kind of that overall health.
And making sure you come to the doctor at least once a year
for come to see us. Yes.
for a checkup and just
get your
normal
checkup,
routine
screening
blood
labs,
work.
things like that, routine blood work. Absolutely. We want to catch it before it develops. Long-standing diabetes can lead to lots of complications with like your heart, your eyes, your kidneys, everything. So we want to catch it before then and make sure we keep it under control.
Thank you so much, Dr. Hammond.
Thank you so much.
It's been a pleasure. I really appreciate all the information you shared with us.
Thank you.
Guys, for all your healthcare needs, don't forget, come to Baton Rouge Clinic. They will take care of you from the top of your head to the tip of your toes and support local.